Thank you, Mr. Vice President, for the opportunity to express my views on the current healthcare debate. Now, I myself am not one of those who, I guess practically you could say healthcare reform is targeted towards, because I currently do have insurance through one of my 3 part-time jobs, although I'm not quite satisfied with it because of the there's some higher co-pays and as well as some other issues. But I do feel that I do need a better choice as to what my healthcare choices should be. I should not have to rely on an employer to provide for my healthcare, and if I choose to go on my own, I should be able to buy or sign up with a healthcare plan that I can afford without having to pay an arm and a leg to get onto. I do not have any pre-existing conditions myself, but my father has Parkinson's disease. He's got high blood pressure. He's got type 2 diabetes. So if he were to buy something on his own, he could be denied care. Also, my mother has a form of dementia that's now put her in a nursing home, and the experience that my father has had in putting her in the nursing home, getting her on Title 19, basically gave him almost almost even higher blood pressure, frankly, because he had to cash out my mother's 401k, his 401k, and a bunch of other assets in order to get below that threshold so that Title 19 can take effect. My brother, he also has high blood pressure, and he also has maybe a couple other pre-existing conditions. So if he were to be on his own, and he just got a new job today, so he would have to try to get onto their health plan, but his is only going to be, he's going to be on there for maybe 4 months, if not sooner or longer, because it's seasonal. But if he were to get something on his own, he probably would, maybe might not get coverage because of his high blood pressure. Now, so of course, I might be lucky that I would be a good candidate to be able to buy my own insurance, but I want to be able to get it at a rate that is affordable to me with my job situations, and of course, if I were to get something, or let's say I were to quit one of my 3 part-time jobs, if one of the other 2 becomes full-time, I would have to sign up with one of the other 2 when their open enrollment period starts, or if hours change, if they allow it, then I would have to go through a whole bunch of hoops in order to get onto their health care insurance. Now, I want to be able to get something that would be portable, affordable, and be able to cover a whole lot of things that I would need to have, and that wouldn't have to put a lot of money out of my own pocket. Now, let me tell you a couple of examples as to why I feel so impassioned about this. Last winter, I had to cut short a shift of at one of my 3 jobs because I was not feeling all that well. It ends up I had gastroenteritis, a stomach flu, basically. And it was like when I had, it was like late at night. It was a shift that would have ended at about 10 o'clock in the evening, but I had to leave an hour early, and then I just couldn't get the symptoms to suppress. So at about midnight or 1 a.m., I had to go to the hospital emergency room because urgent care and my doctor would not have been open at that time. Now, they had to give me 2 bags of saline IV and a 1 quart bag of, or a 1 pint bag of glucose IV. And they also had to take a blood test, try to take a urine sample, a whole lot of other things to see if there's anything else wrong with me. The total cost of my hospital's of my emergency room, say, because I was released at about 5 in the morning about 4 hours later, basically. The whole cost was billed to my insurance company of about $1,200, $1,100 to $1,200. My insurance company only paid $500. So that means I am responsible for about $600, less than half of that bill. Or actually, they only paid less than half. So basically, many insurance companies are not really looking at their patients. They're looking at the bottom line. And that if they only pay half or less than half of a patient's emergency room visit when it's like 1, 2, 3 in the morning and they can't get to their doctor, and they can't get to or they feel that they needed the treatment right then and there. That's irresponsible. Not being a responsible corporate citizen. Another example. I also have dental and vision plan with my insurance. The vision plan is okay. It is a discount, about 10% off of my contact lenses, and a little bit of discount off of my exams. That's fine and dandy. But the dental part, you would expect that the dental insurance to pay about the same levels as it would be for medical insurance. I had a root canal about 2 years ago, or maybe a year and a half ago. It was right here. This was an earlier one. But right here, I had a root canal. My dentist said that my insurance should pay about 80%, and I would be responsible for 20%. Ends up it was the other way around with my insurance company. I was responsible for about $350 of about a $500 procedure. And I had trouble paying it off. And then on top of that, I had to take care of a wisdom tooth, which, again, that was more like a 50-50 proposition there. But the thing is that these insurance companies have to be reined in on how they do business, and healthcare reform with a public option will help them do that. If they have if there's a public option out there that it is optional, not mandatory, but there's a public option out there that will help drive down those the premiums by having it being cheaper than private insurance. Basically, when you have 2 different levels of services and they're competing against each other, and there's one, and if you get the same quality of insurance, and you have the premium down here, and if people are going away from this in order to go to this, it's going to go down. They're going to bring it down so that it can be competitive with the less expensive plan. And then, of course, also, if this even has better coverage than this would also increase its coverages and increase the quality of its services while bringing it down to attract people who would go here to come back here. And then there you go. You would have lower cost, better quality healthcare coverage for everybody. So this thing that the health care coverage is not a high concern for everybody or for most people. Well, it's a concern for me. Thank you once again, Mr. Vice President, for your time, for giving us the opportunity